Thank you very much for following this link to our video. I'm Professor Edward Janus and I'm the Chairman of the Board of the Heart Research Centre. Now at the Heart Research Centre we undertake research so that we have the information to develop programs to benefit patients with heart disease and stroke and their families. This translation of research into practical action is central to our efforts at the Heart Research Centre. Now, for example, we've just completed a study of 400 cardiac patients looking at their needs when preparing to return to work. And we found that one major barrier for return to work was depression. Very little work has been done on the impact of acute illness on partners of patients. So we've started a new study to find out how partners cope and their main concerns. We've also tackled a new area of research looking at cardiac patients from rural and regional areas where new services are so desperately needed. In these areas, resources are limited and we need to find ways to optimize them. Importantly, we've commenced our first research project into Aboriginal heart disease and stroke. Unfortunately, Indigenous Australians experience cardiovascular disease and stroke at more than 4 times the rate among the rest of the Australian community, so action is desperately needed. To develop prevention and rehabilitation programs which will work in Indigenous Australia will of course require their participation and their input. Finally, I'm very pleased to report that our staff won several awards during the year for their excellent research. Dr. Eleanor Turner won an award at the Heart Foundation Conference in Melbourne, and Dr. Rosemary Higgins received the Best Research Award from the Australian Cardiovascular Health and Rehabilitation Association. Of course, our research aimed at practical outcomes and helping people with all sorts of heart disease and stroke must go on. If you're able to help us further, that will be wonderful. Thank you.